a lie that hit a child's last moments, and a community that searched for answers for the wrong story. If you want to follow every verified development in this case, hit subscribe and turn on the bell now so you get first-hand updates as facts are confirmed. Emmanuel Haro was already dead up to 9 days before his mother reported a kidnapping on August 14th, 2025. That detail, that prosecutors now place his likely time of death well before the day of the reported abduction, flips the timeline and forces a painful re-examination of what everyone believed at first. When a child is reported missing, the immediate assumption is a sudden disappearance. An abductor, a frantic scramble, a public search. That was the public story people rallied around. But investigators say the evidence points in another direction entirely. The child's death preceded the staged alarm. Saying a child died days earlier is not a dry forensic note. It reorders responsibility, accountability, and the narrative the family fed to the public. If Emmanuel's death occurred even a week before his kidnapping report, questions explode outward. Who knew what, and when did they know it? Why did the parents wait to say something to authorities? Why was a story of a parking lot attack presented when investigators now believe the child had already been harmed, perhaps fatally, in private? The implication is devastating. The disappearance story was not a call for help so much as a cover story meant to protect those who inflicted harm. That also changes the investigative priorities. Instead of looking first for an unknown abductor working in plain sight, detectives shifted inward to the household and to individuals with intimate access to Emmanuel. The shift matters legally, emotionally, and socially. It reframes neighbors' memories, makes earlier warning signs sharper and more damning, and turns communities mobilizing compassion into a scene of manipulated grief. Understanding that time window is a cornerstone of this case. It tells investigators where to look for forensic traces, why certain records matter, and why certain inconsistencies in statements no longer seem like small memory lapses, but possibly like deliberate obfuscation. When the reported timeline and the medical/forensic one diverge by days, the difference is not academic. It is the difference between a potential rescue and a potential chance to hide a crime. Prosecutors allege that Emmanuel endured severe abuse across his 7 months, and that the so-called parking lot abduction was staged to hide his death. This is not a single allegation of a momentary lapse. Prosecutors outline a pattern. Over time, they say, the child suffered neglect, malnourishment, and physical trauma, a series of events that together define a life marked less by infant care than by harm. In such cases, experts look for patterns, repeated injuries in various healing stages, signs of neglect like poor growth or untreated medical needs, or inconsistencies between an explanation and the pattern of injuries. Prosecutors say those patterns exist here. If proven, the implication is grim. This was not an accident in the true sense of the word, nor a sudden, isolated tragedy. Instead, it would represent a sequence of acts or omissions that culminated in a child's death and a subsequent cover-up. A staged kidnapping fundamentally changes how the public and the justice system view the parents' actions. It suggests intent, or at least awareness, not just at one moment, but across the period leading up to the child's disappearance. Legally, the distinction is crucial. A homicide charge grounded in long-term abuse rests on proving a continuity of neglect or deliberate harm. Investigatively, it means detectives must probe medical records, feeding logs, caregiver statements, and any attempts to hide evidence of poor health. It also explains why prosecutors have emphasized prior contact with child protection or prior criminal history. Pattern matters. For the community, this allegation is a blow that transforms grief into outrage. Volunteers, neighbors, and professional helpers who searched believing they were finding a stolen infant now face the reality that they may have been part of a public performance meant to mislead them. That sense of betrayal turns empathy into a demand for answers, not only from the accused parents, but from systems that had contact with the family. Surveillance recordings and witness accounts contradicted the mother's claim of a sudden parking lot attack and abduction. From the start, the parking lot story had the raw elements of a Hollywood nightmare. A quick change of diapers, an unseen assailant, a parent collapsing and waking to an empty place beside them. Those images pull at people's hearts. But investigators say the objective footage told a different story. Cameras in the area did not capture the violent ambush described, and witnesses did not report seeing a stranger running away with an infant. Those are not minor discrepancies. In modern investigations, video and third-party observation are invaluable precisely because they are less subject to the frailties of memory under stress. When camera frames, timestamps, and witness recollections don't match the public claim, detectives must reconcile the contradictions. Either the advertised sequence of events did not happen as told, or crucial evidence is being withheld. Given the other information now known, alleged abuse, timing of death, prior family history, the inconsistency between the parking lot narrative and the recorded scene contributes to a broader suspicion that the abduction story was constructed. For residents who volunteer to search based on that story, the revelation is especially heartbreaking. They followed a lead that, by the time they mobilized, may have been designed to divert attention. For investigators, disproving the public version of events is a powerful tool. It narrows suspects, changes search priorities, and sets the stage legally for charges alleging false reporting and cover-up. The community rose up to search, and those volunteer efforts were sweeping and intense, but they were also directed by a false narrative. In the days after the initial missing person alert, neighbors, church groups, school staff, and strangers from neighboring towns poured into the search. That kind of grassroots response is a civic strength. It shows how communities rally around vulnerable members. But in this case, what the community was searching for, a stolen infant taken in broad daylight, may have been a story created to mask other facts. The emotional labor of those volunteers cannot be understated. Hours walked, fields combed, flyers distributed, and endless calls to tip lines. People gave their time and their faith to a version of events that prosecutors now say was deceptive. That sense of being misled fuels public anger. Beyond the immediate emotional response, there is also the practical consequence. Volunteer resources are finite, and when misdirected, they can delay the discovery of other leads. Moreover, the manipulation of public goodwill raises ethical questions. Did the parents intentionally exploit the community's compassion? Were officials played into a narrative, or were they led by what they were told in good faith? The answers will matter when assessing accountability beyond criminal charges. For instance, whether any policies need change to avoid similar public manipulations in future cases. Both parents, Jake and Rebecca Haro, were arrested on August 22nd and charged with murder and filing a false police report. Those arrests were not the first public development, but they represent a legal turning point. The state has formalized accusations and moved from investigation to prosecution. Arrests at this stage indicate that prosecutors believe probable cause exists to hold the pair on serious charges. The murder counts reflect the allegation that abuse led to death, while the false report count addresses the claimed fabrication of a kidnapping. The dual nature of the charges captures both the alleged underlying harm to the child and the subsequent effort to mask that harm with a constructed original story. For the community and the justice system, arrests raise immediate procedural questions. What evidence justified this level of charging? Will the prosecution be able to prove causation between the alleged abuse and death? How will defense counsel challenge the narrative? Press coverage and public discussion will follow the court process closely, but in this critical period, restrained, evidence-based reporting and careful legal scrutiny matter. The arrests are a step toward accountability, but they are only a step. The justice system's job is to convert alleged wrongdoing into proven facts in court, and that requires time, forensic clarity, and careful legal processes. Investigators say the truth about Emmanuel is that he endured neglect, malnutrition, and repeated violence rather than the safety he should have had. These are not abstract terms. Neglect can mean missed medical appointments, inadequate feeding, or unsafe sleep conditions. Malnutrition can show up in weight measures, developmental delays, and clinical signs. Repeated violence leaves a history of injuries in various stages of healing, each telling its own story. Together, these signs paint a picture of chronic harm. Medical professionals and child protection experts recognize patterns. Isolated injuries could be accidents, but repeated harm across time suggests an ongoing environment of danger. For investigators, assembling the medical record is crucial. They look for growth charts, hospital notes, ER visits, photographs of injuries, and testimony from pediatricians or nurses. For prosecutors, these documents form the backbone of a narrative that argues a child was not merely the victim of one bad incident, but a sustained pattern of harm. For the public, these findings are especially painful because infants cannot tell their own story. They rely entirely on adults for care and protection. When those adults fail repeatedly, it's not only a family tragedy, it is a civic one. The evidence of chronic harm challenges everyone who interacted with the child or family, from neighbors to social service agencies, to ask what signs they missed and how prevention might be improved. Jake Haro's 2018 assault on his infant daughter left lasting damage, and his prior case resulted in probation rather than prison. That earlier criminal record is a painful and critical piece of context. Prosecutors and officials have pointed to father's prior conviction as evidence of a dangerous history that, if treated differently by the justice system, might have prevented later tragedy. Past abuse cases inform current risk assessments. They flag individuals who, statistically, are at higher risk of repeated offenses. The fact that the earlier prosecution led to probation rather than incarceration is now being criticized by prosecutors as a missed opportunity to protect future victims. That criticism is not just rhetorical. It reveals how discretionary decisions in the criminal justice system, from plea bargains to sentencing choices, can have long-term consequences for public safety. The Haro case will likely spur debates about sentencing, probation supervision, and the link between early interventions and later outcomes. For families and advocates, this becomes a clear illustration of the stakes involved in prosecutorial and judicial decision-making. Prosecutors have openly condemned lenient prior sentencing as a contributing factor to Emmanuel's death. When prosecutors say prior leniency was a mistake, they aim to do more than assign blame to a single judge or prosecutor. They are raising questions about systemic patterns, whether the laws, policies, or practices that led to probation in a prior harm case are adequate to protect children. This is a political and policy flashpoint. Advocates for child safety will point to this case as evidence that stronger penalties and better enforcement could prevent future harm. Those who emphasize rehabilitation and proportionality will caution that blanket increases in punishment are not always the answer. Still, when prosecutors frame a prior outcome as a direct line to a later death, it forces public institutions to review whether the balance struck in earlier cases adequately weighed child safety. The community response to such a critique is often visceral, anger at systems perceived to have failed. And that anger can catalyze policy reviews, administrative inquiries, and calls for legislative change. Emmanuel's story exposes ignored warning signs, systemic breakdowns, and a culture of silence that allowed abuse to continue. This is the hardest part to accept. Signs were reportedly seen, words were allegedly spoken, and yet sufficient action did not prevent the worst outcome. When a case like this emerges, civic introspection follows. Neighbors wonder whether they should have reported suspected abuse more persistently. Professionals question whether their interventions were timely and adequate, and policymakers are pressured to evaluate whether statutory thresholds for protective action are too high or enforcement too lax. Silence, by families, by professionals, or by institutions, is often the most corrosive element. It gives perpetrators a space to continue harming without the scrutiny that could stop them. Breaking silence is crucial, but it must be paired with effective response systems that turn reports into protection rather than merely bureaucratic files. The Haro case highlights the tragic human cost when the social safety net frays. This tragedy demands accountability, vigilance, and action if other children are to be spared the same fate. Accountability means more than holding the accused parents to legal account. It means reviewing prior decisions, ensuring probation and child protection interventions are robust, and supporting frontline professionals with the training and resources they need. Vigilance is about communities refusing to normalize suspicious signs and making reporting easier and safer. Action means policymakers and agencies committing to concrete reforms, clearer protocols, better follow-up on reports, and resources for families in crisis. Emmanuel's death is a call to transform grief into systemic change so that future warning signs lead to protection rather than platitudes. Strong wrap-up. This case strips away comforting assumptions. A reported abduction turned out to be, prosecutors say, a cover for prolonged abuse and a death hidden behind a lie. The legal process will now run its course. Evidence will be tested, defenses raised, and a court will determine what actually happened. But the larger lesson is social. When neighbors notice, when professionals flag concerns, when systems are told and then do too little, the consequences can be fatal. Emmanuel's life was short and his death, if allegations hold, was preventable. Keep the focus on verified facts. Support investigators with credible tips, and push for reforms that make protecting children easier and more certain. Silence, in this case, was not neutral. It was complicit. We owe Emmanuel a better legacy than that. If you have relevant, verifiable information, contact the Riverside County Sheriff's Homicide Detail immediately. Justice and prevention require both truth and action.